Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons. In that time, I've helped thousands of women in their surgical journey. My passion to educate and help women feel empowered is what led to what we now know as the Big Butts, No Lies podcast. Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun. Hey guys, welcome to episode 2 of the exclusive Big Butts, No Lies membership podcast episodes. I'm super excited about who I have on today. Dr. Heather Flexer. You might know her on Instagram as better_wounds. She is a 20 plus year doctor of physical therapy and wound specialist. So why am I bringing on a wound specialist? You guys know I'm never going to pretend or tell you that anything that we do with surgery comes without risk, because it's not true. Everything we do comes with the risk. And one of those risks with long incisions is wound breakdown. Dr. Flexer, thank you so much for being on today. I cannot wait.
Thanks for having me.
I can't wait for you to just fill our brains with so much information. And I'm excited about this because I feel like it's not really talked about as much as it should be.
Yeah, I mean, nobody goes into surgery thinking they're going to have a problem, right? We see these beautiful pictures, these amazing transformations, and that's what we're going for. But it's just the part of the whole process is that you can have a complication. Either you can have some stitches that pop or a burn from liposuction.
Right. So right before we started recording, I told Dr. Flexer, this could be a very long episode because there's just so much for us to talk about. But one of those things, she's going to have to come back. We're going to have to split this into 2 episodes. But one of those things that I want us to talk about on this episode is lipo burn. So lipo burn, if you guys, I'm sure if you're doing your research, if you're looking online, you've probably seen pictures of black necrotic skin that turns purple, then it turns black, and then it kind of scabs off. So Dr. Flexer, can you tell us a little bit more about your experience with lipo burn and also / faja burn, and why is it mistaken for the same thing?
Yeah, you can call me Heather. So lipo burn is going to be common when they're using like heat or ultrasound, not just the suction, which is very common, especially if you're trying to get like a tightening. They're trying to liquefy the fat to be able to get more of it out. And they're using thermal energy to do that, and could potentially cause a burn of the skin, especially if they get closer to the surface of the skin. And at first, when you come out of surgery, it's a little hard to detect what exactly is going on, because I'm sure you've seen like all the bruising that happens, and that's just part of the damage to the tissue as they're sliding that cannula back and forth. So some of it, that purplish bruising, is common, and it's hard to tell at first what's going on. So if you come out of surgery and you're purple and you're bruised, that could be potentially normal. If you were to go, even on my Instagram, there's several pictures of it where you'll have this mottled purple look, and then in the center is a much darker area. Usually you can tell that it just looks like there is deeper damage going on. Sometimes people will have blistering, and that's like a telltale sign, but sometimes they won't, and it'll just be deep purple and different looking. It might be a little squishier, or it might be a little hard when you touch it.
Okay. One of those topics, in this industry that I think we need to talk about more is, y'all know on the show, I always tell you guys, I might not know the answer, but I can probably find somebody who's an expert on the subject. So I always tell you guys, for massage, you go to your massage therapist, you go to the expert in that field, right? So our plastic surgeons are experts in plastic surgery. They do have wound knowledge and wound care knowledge, but would you say that they're experts in wound care?
Oh no, they know how to do surgery, right? They get you through the process. They do the procedure. My experience with most surgeons is they know very little about healing wounds and what to put on them. So going to your plastic surgeon, that's what you should do. You should be in touch with your surgeon if you're noticing anything out of the ordinary that you didn't expect. You should be communicating with them absolutely 100%, but they may tell you it looks fine, or they're just not surprised by it. They see this stuff all the time. And your massage therapist, it really isn't equipped to treat an open wound either. They don't have the training for it. They really should not be doing any kind of
wound
treatment to your wound. Yeah, they should not be draining your seroma. They should not be opening your incisions. They should not be scraping the wound in any kind of a way. You need to be, if you have an open wound, you really should start looking for a wound care specialist in your area. So that is always a big suggestion of mine, is just, you have an instinct that something is wrong. Your surgeon probably can't help you. Your massage therapist shouldn't be the one helping you. You need to get into a wound center.
Okay. So one of those, now that you touched on it, what practices are you seeing commonly that you think, well, now we have the platform to, voice a concern? One of those things that I can, off the top of my head is incisions being reopened by massage therapists is a big no.
Yeah. There's all sorts of practices out there. People are from all over the world and learn different things, but I don't know of any state where it's within the Practice Act of a licensed massage therapist to use any tool to open an incision. Their license is at risk when they do that. I know some people are going to unlicensed professionals, body contourists that may not have any license to be touching someone's body. When you open up incisions, I understand like the fluid is uncomfortable, it's swelling, you just want it out of your body. If you were leaking from your incisions, like within the first week or so, that's one thing, right? Like that fluid is leaking out of a hole, right?
Mm-hmm.
Sometimes you have a drain. Sometimes you don't have a drain, and fluid will find a way out. So that's one thing if your body does it naturally. It's another thing to take a tool and open up an incision, or to poke a hole or drain something. It needs to be done in a sterile environment. It should be done by a medical professional and usually under the supervision of a physician. So they're in a medical practice, not like a massage practice that's like they're coming to your house, or, it's just a standalone facility.
Correct. So now there's two things that if you guys are taking notes, so you don't want anybody reopening your incisions at all. Don't let them touch them. Don't let them, if they think you need to drain more, do not let them reopen your incisions. There's a lot of things that could go wrong. And one of those things you're introducing bacteria.
Yeah. Infection is high. The rate, you're opening yourself up to infection, and you're also, as wounds heal, the scars, they never fully get up to the strength of your regular skin. So every time you open up the skin, it gets weaker and weaker. So you're just creating like an area of weakness. And if you're someone that keloids, you're creating more of a problem every time.
How can our girls know when it's something beyond, okay, my surgeon can take care of this, or, this is normal? What is like a telltale sign, like, okay, maybe you should go see a wound care specialist?
I think if you're following your doctors, let's say that's such a loaded question, right?
Because I know.
If you are healing as expected, like you have not had any complications, or maybe you've had like a tiny little burn, or like a stitch has popped or something, but you are following their recommendations and you're healing, you're fine, right? You don't need to like raise an alarm if all is going well. If you are having issues with like repeat infections, your wound is reopening or getting bigger, if in all honesty, if they're telling you to do wet to dry, like in your wound, that is such old wound care that we can do better than that at a clinic. So those are some, if you're not healing normally, if it's been a week or 2 weeks and your wound just looks the same, and they're just telling you, oh my God, it's going to take months to heal, I would go to a wound care specialist.
Okay. So, one of the things that happens, often with any surgery, either a breast augmentation or a tummy tuck, when they're suturing underneath the skin, it's very common to have sutures spit. So what that means is, like, for our listeners, if you're looking at your incision line and it'll start looking kind of like a pimple or like something like a bump or a little red bump, you feel it, and it'll start to work its way out through the skin. So those types of, I wouldn't even, it is, I guess, technically a complication, but it's so common. Like we see in the office, I would see it all the time. And those types of things are not really something that we're really, really worried about, because the stitch will get pulled out or they'll cut it and it'll heal up perfectly. What we're talking about is more these wounds that at your incision line, when you start to see like your incision's not healing correctly, or it's not healing properly, or if you have a collection of fluid that continues to come back. If you are 3 weeks out and you are having a seroma drained every week, it's probably time to see, a specialist about it. Is there something that y'all can do? What do y'all do for those types of things?
The seroma, sometimes they need to be like surgically removed. Those are not the biggest concern. They'll eventually get figured out, whether it's more compression, whether it's like some antibiotics that you need to be put on, whether they need to go in and remove like that pocket of fluid. But it's the like when your whole incision line starts to kind of break down and separate. Those are absolutely go to a wound care specialist for that. I hear a lot of times where the plastic surgeon is just like, I'll just stitch it back closed. But that actually goes against how we normally treat wounds. Once it opens, it's like trying to stitch together like frayed jeans. Like it really it's so fragile, and there's probably underlying infection in there, or there was too much tension. There's just not good tissue to trying to pull together. We often see like people reopen multiple times.
In your experience, Heather, of 20 plus years, I'm sure you've seen a lot. Would you would you say that there are some precursors or something that you can kind of tell when somebody's going to have a complication, or they're more probable to have a complication, like their incision opening? Is there something that you see frequently?
Well, definitely your general health is a big thing. There's a reason why they try to have a BMI, under 31 for a lot of these cosmetic surgeries. It's not medically necessary, So they want you in the healthiest state possible. Diabetes is a big one. If blood sugar is huge, it just prevents wounds from healing well. If they're removing like a large amount of tissue and they make it super tight, they remove a lot of tissue, they make it super tight, and then you're swelling on top of it. It's just too much tension. So that's always a risk factor. It really is in your best interest to go into any surgery as healthy as possible and as active as possible.
That you've heard us, I've said that before. My healthy patients have the best recoveries, less complications, less downtime.
They seem to have less pain too. Like they are better equipped to go through this recovery process, because it's a long process.
It is a long process. I'm going to tell you guys about you guys know I coach my girls, right, through surgery. And usually I can tell when somebody is ready and when somebody's not ready. And even if I'm trying to prepare them and I'm giving them information, you can only give so much information before it's like, okay, well, you're not listening to me anyway. So
good luck.
Good luck.
Good luck with that.
Yeah. One of those things is like, hey, at least for the next 6 months, try to start working out, a couple times a week, 3 or 4 times a week, even if it's just walking, getting your heartbeat, getting your blood flowing, getting, healthier, getting more active. So I had one of my girls who she is a massive weight loss patient. She lost about 70 pounds. She had the gastric sleeve, and I've had a really hard time getting her to work out or even get active. And I know she's busy. She's a mom and she has a full-time job, which makes it difficult. But she was planning for surgery, and she actually just had her surgery on Monday. And I went and I saw her. Everything looked perfect. Everything looked good. The doctor did an amazing job. And now she's calling me yesterday. What's today? Her surgery was last Monday, not this past Monday. So today she's calling me or yesterday she called me and she was really concerned. She's like, I'm having too much swelling. She said, I get up and there's just so much tension in my stomach. My stomach gets rock hard. I have to lay down or else my stomach hurts. It hurts. And so I'm trying to figure out, okay, you know what? Is this something that we need to call your doctor about? Do we need to call your doctor is what I'm trying to figure out. And she's like, you know what? When I get up, it hurts. When I lay down, it hurts. My back hurts. Everything hurts. I'm worried. I think there's this huge ball of liquid collecting in my stomach. So I'm like, you know what? Call your doctor. You need to call your doctor, send them some pictures, see what it is, because she wouldn't send me pictures. That was the other thing. She wouldn't send me pictures. I'm like, okay, I can't tell you if it's an emergency or not if I can't see it. So call your doctor. So she calls her doctor and it was just normal swelling, just normal. And they sent me a picture and everything looks perfect. And she looks amazing. Great. But the point of all of this is, even with me coaching her, telling her, this is what you're going to feel. This is what you can expect. This is how you get ready. She was not ready for surgery. And you have to be ready for surgery. She was not mobile after surgery. She's been laying down for the majority of the time. And this is week 2. She should be getting up, walking, at least walking around, maybe a Target, at least something, get up and moving. And so since she's not doing that, this swelling, this, abnormal to her amount of swelling is a huge concern. So now she's stressed. She's worried. Yeah. She's, not focusing. Now she's hyper focused on the ridiculous amount of swelling and how bad it is. And what I want you guys to learn from this, you have to be ready. You cannot cheat the system. If you are not working out, you can tell me you're working out. That's fine. But if you're not doing it, you're the one that's going to feel it after surgery. You're going to be the one that's wishing, man, I should have been working out. I am out of breath getting out of bed. I am out of breath just standing, taking a shower. So you guys, please listen, get your health in check, your diabetes under control, have it completely under control. Don't just get it under control for surgery. Don't quit smoking cigarettes just for surgery and then start smoking right back. You can think that you're going to cheat the system or you're going to, lie and say, oh, you quit smoking. Oh, you're working out. You're eating healthier. But if you're really not doing it, it's doing you no good to even just say that you are. It's doing you no good at all. Because if at least you told me, hey, I'm not really working out. I'm not really changing my diet. I would tell you, hey, you're not ready for surgery. Maybe you should postpone until you're ready. Maybe this isn't the right time. Maybe you need more time to prepare your body. So my concern for her is I really hope she does not have any type of wound breakdown. So I'm keeping an eye on her more. But, these things you guys don't really know until you're in it. Like Heather, she knows, she's seen it.
It's a total mind game too. You really have to be mentally strong to get through all of this as well. So
Yes, you hit the
figuring
nail on
out
the head.
how, figuring out, because a lot of times, so people will send me, I always have people send me pictures first because, someone will say like, oh my God, I just have this little tiny black spot on my, can you tell me what to do with this? And they'll send me something and I'm like, oh my God, like it's not a little black, like, no, you need the doctor right now. But so it can go either way. Either people are very like nonchalant about everything, like, oh, it'll be fine. Or they are like hyper focused, freaking the F out about what's going on when they don't need to. So you really need to, the best thing you can do is start being active, figure out, whatever practice of spirituality or mental health that you need, because there is a total mind-body connection. So you can definitely run yourself in circles in your mind that will hold up your recovery. And stressing out about stuff really doesn't help at all.
At all. Dr. Heather, or Heather.
That's fine. Yeah. So for that lady, I would say to her, I mean, she really needs to start. It could be simple stuff. Like if feels like she's got to lay down to be comfortable, fine. But she needs to be doing some deep diaphragmatic breathing. That's going to help to stimulate her lymphatic system, which is going to help circulate the swelling out of her body. She should not just be laying around, like laying there. She should be pumping her ankles. She should be squeezing her thighs, squeezing her butt, trying to do some bridges. Like if you're not physically able to like walk around the block, that's fine. We can start wherever you're at, but you need to start activating your body. So activate whatever can be activated. Drink lots of water so that you can have to get up and go pee. Then you're at least getting up and walking around the house. You gotta start wherever you're at, but you already had the surgery. Now you just need to like keep going, and nobody can do it for you. You have to get up and do it yourself.
Have you seen some of these supply lists? What
have you seen? What
have you seen some of these supply lists that are out there that are like, you have to get everything on this list before surgery to have a great recovery or to be prepared?
I have. Good. I've seen some, but
my question is,
why are you buying all this stuff?
Yeah, that's my question. So a lot of the stuff on these lists is for wound care. They're buying a whole bunch of stuff for wound care. So I want you to, before the end of this episode, teach us what is the best way for us to treat our incisions for them to heal faster or heal right.
Okay. So first of all, you can get everything, within 2 days off Amazon anyway. So you really don't need to be buying a whole host of wound care products because you have no idea, and hopefully you won't have a wound issue. So you shouldn't be buying a lot of wound care products because you're going to treat your wound specifically as it happens. Most incisions should be kept clean and dry. So you should not be putting any ointments on them initially until all the stitches are gone. So clean and dry. I normally do not recommend antiseptics on the incision. Antiseptics are for treating like an active infection. Maybe you're going to use it for the first day or two after surgery just to make sure it's clean. But other than that, you should put that Hib cleanse or whatever, like betadine, alcohol, all that should be put away after the first few days after surgery. And you can just use like a regular antimicrobial, like Dial soap on your body when you're cleared to start taking a shower.
Perfect.
So I would not buy much.
You don't need 3 tubes of bacitracin or Neosporin.
Probably not. Neither. Probably neither. Because you want it to be dry. So it's not until you're till the stitches are gone or until it's all, if you've got the little scabby stuff on there, that's good. Leave it alone. Stop messing with it.
Mm-hmm.
I think people are potentially creating a bigger problem by trying to treat the scar or like have a good looking scar before you're even out of like wound care. So like you should not be putting scar creams or silicone tape or anything until you're probably 3 or 4 weeks out of surgery. So you have plenty of time to get whatever you need.
Thank you for saying that, because I just had this episode a few weeks ago where I'm like, you guys do not need to buy all this stuff. You don't need to have all of this before you even have surgery, because you don't even know if you need it. Some of this stuff is ridiculous.
Then you get all confused and you're not using it right anyway. So you try like mixing, I'm going to do this at this time and this at that time and this, and it's all a mess. So just save your money. If you have a wound that opens up, we'll give you my information, but you feel free to reach out to me and I can help put you in the right direction if you don't have a wound care specialist nearby that you can reach out to.
Awesome. Heather, can you tell our girls where they can find you? Heather's going to be a part of our membership, so you guys looking for that. But she is also going to be offering services to you guys with a special for the members.
Yeah. So I always have folks, like if you reach out to me, you can reach out to me right on Instagram. It's better_wounds. Or you can go on my website, which is betterwounds.com. And there's a like help button there. You can tell me where you found me and I'll remember what's going on. But I always have folks send me a picture first, because it's very common that you're, oh my God, I don't know if I'm doing the right thing. And you show me a picture. I'm like, you're fine. It looks great. Keep going.
Perfect.
But if it's in the case like where we actually need to get on a conversation, then you can book a consult. And there's a link for all of that, either way that you connect with me. And because you're part of this group, you can use the code 10OFF and that'll get you $10 off a consultation. And what I do during that is like a face-to-face, we get on like video chat. I have you send me pictures. I have you tell me whatever, if you have products available to you, whatever you've got in the house. And I tell you how to use them, what you're going to do, how you're going to clean your wound, what to do next. If you need to buy anything, I tell you what to get. So I try to get everything off Amazon, and I'm pretty cost conscious as well. So I'm not making you buy the most expensive thing unless it's what you need.
Exactly.
So yeah. And if I can't help you because I look at it and I go, oh my God, you need to go to urgent care, then that's what I'm going to tell you as well.
Perfect. Which is exactly what we need. Okay. So lastly, you guys, I have so many notes down here. I was writing like questions that I wanted to cover, but I'm trying to keep these episodes on the membership a little bit shorter. I know we've done the long form episodes of like an hour and a half. And I want these to be a little bit shorter so y'all can actually like get through them and you don't have to designate a whole, hour and a half of your time, and we can get through the information quickly and y'all don't have to spend so much time. So I think I'm going to keep my questions for the next episode. We've got a good basis here, I think. And each episode, we're going to learn more and more and more. And I'm so excited. Heather, thank you so much for coming on today. This was amazing, educational, informational.
Thanks for having me.
And the next time, let's talk about these large, wounds and wounds in other areas. So there's a lot of women having thigh lifts, and we know, thigh lifts are notorious for wound breakdown. So I think in the future, I want to do episodes for each body part, legs, if there's any wounds, or abdomen. Especially, you guys don't think about this, but brachioplasties, right at that T at the axilla.
Wounds are I'll see a lot of pictures that come, or consults and stuff that come to me. It's like under the breast with a breast lift. I've gotten a few of the thigh lift, a lot of like large tummy tucks or the circumferential body lifts. Anywhere where they're trying to reconnect, like where there's a T junction, in that middle part, it's just too many parts. I think they're trying to stitch together and it just kind of breaks down a little bit. So
we have a lot to learn. We still have a lot to learn about this. All right. Thank you guys for joining us on this episode, and I'll see you guys next week. I would like to end this episode with a huge thank you to all of our listeners. If you enjoyed this podcast, make sure to subscribe to Big Butts No Lies Podcast and follow us on Instagram at Big Butts No Lies Podcast. If you have a topic you want me to cover, please send it to the DMs. If you know anyone on their plastic surgery journey, be sure to recommend them the show. You can also visit us on our website, bigbuttsnolies.com. You'll see the online surgical recovery store. We're adding new items all the time. If there's something you think I need to have on there, send me a DM. Don't forget to leave us a 5-star rating on Apple Podcasts. And don't forget, new episodes every Monday. I'll see you then.